The signs of vitamin D deficiency are subtle or non-existent, making it difficult to diagnose. It is the most common nutrient deficiency in the United States, with more than 50% of people having low vitamin D levels. Vitamin D has been linked to many health benefits, including reducing the risk of fatigue, depression, anxiety, muscle weakness and pain, mood changes, aching bones, and autoimmune diseases such as multiple sclerosis and rheumatoid arthritis. However, many people are not getting enough vitamin D through their diet or exposure to sunlight because they live in areas with less sunlight, or their diet is poor in vitamin D. The good news is that vitamin D deficiencies are preventable and easy to treat. There are many ways to increase your intake of this important nutrient. Eating more fatty fish like salmon or tuna, eggs, and dairy products. By spending time outside in the sun for at least 10 to 15 minutes each day, or taking a supplement that contains vitamin D3. Vitamin D deficiency is a major health concern. Here are the 12 signs of vitamin D deficiency that you should be aware of. The first sign of vitamin D deficiency is fatigue and tiredness. Fatigue may be an early sign that your body has insufficient levels of vitamin D in your blood. Symptoms include feeling tired all the time, with no energy to do anything else. It is also a common problem that can lead to frequent headaches. The second sign of vitamin D deficiency is pain in the lower back, buttocks, or legs. This pain can be mild or severe, and it can happen all day long, or just after certain activities like sitting in the desk for too long, but mostly at night. The third sign of vitamin D deficiency is bone pain, most often seen in the hands, wrists, and feet. Bone pain typically occurs after a person spends a lot of time indoors with little to no exposure to sunlight because they are continuously wearing shoes and gloves, or have an autoimmune disease that has diminished their ability to synthesize vitamin D. When someone has bone pain, it often means that their bones have weak spots where they could break easily if the person falls or twists the wrong way. The bone pain can be mild or severe, and it can happen all day long, or just after certain activities like sitting in the room or office for too long, but mostly at night. The fourth sign of vitamin D deficiency is depression, often accompanied by a loss of interest in daily life. Depression, also called low mood, is more likely to happen when someone has migraines or bipolar disorder. The fifth sign of vitamin D deficiency is muscle weakness, often caused by the use of certain drugs such as steroids, chemotherapy agents, and anticonvulsants. Vitamin D makes muscles stronger to help us walk, keep our bones healthy, and protect our organs from injury. The sixth sign of vitamin D deficiency is a type of bone disease called osteoporosis, which is characterized by reduced bone density and leads to a higher likelihood of fractures or broken bones. The seventh sign is an increased risk of multiple sclerosis, which is a condition characterized by the progressive deterioration of nerve cells in the brain and spinal cord, which causes loss of muscle coordination, weakness, and numbness. The eighth sign is increased risk of type 2 diabetes, which is a condition characterized by high blood sugar levels, as well as damage to the body's cells that control glucose production and insulin secretion. The ninth sign of vitamin D deficiency is an increased risk for colorectal cancer, which is the third most common cause of cancer-related death in the United States. The 10th sign of vitamin D deficiency is tooth loss, which is estimated to affect about 5% of Americans over their lifetime. The 11th sign of vitamin D deficiency is increased risk for kidney stones, which are more common among those with low vitamin D levels. The 12th sign of vitamin D deficiency is increased risk for certain cancers, including colon cancer. Vitamin D deficiency can cause a number of physiological changes, such as increased risk for hypertension, diabetes, and falls. These changes result in a higher chance of developing chronic diseases such as heart disease and cancer.